Sleep apnea is a serious disorder that robs the body of the precious oxygen it needs to survive and thrive. It can lead to a multitude of medical problems and has serious effects on one's quality of life. But what exactly is sleep apnea? Come on, let's take a look. Hi, I'm Dr. Rick Van Gurp, a dentist at Carolina Sleep Solutions in Charlotte, North Carolina. At Carolina Sleep Solutions, we make custom-made, medically approved dental devices to treat obstructive sleep apnea and snoring. We're highly trained and will work closely with your physician and your medical insurance, including Medicare. If we can help you, please let us know. So let's jump into today's topic. In a nutshell, obstructive sleep apnea is a common medical problem in which part of your airway narrows or collapses during sleep. To understand this further, let's look first at what normally happens when you breathe. You can see here that in a normal situation, when you breathe, air passes freely through the nose, behind the soft palate and tongue, and finally past a structure called the epiglottis before entering the trachea or windpipe. Let's focus on the airway between the lines drawn here. This is part of what's called your upper airway. For the most part, your upper airway can be envisioned as a flexible tube composed of soft tissues and numerous muscles, but lacks significant bony support. Most notably, it contains a collapsible portion that extends from behind the hard palate to the larynx or voice box. And how collapsible that upper airway tube is varies from person to person. Again, how collapsible the upper airway tube is varies from person to person. For some people, the airway is not rigid enough. Think of it like trying to eat a milkshake through a straw that's very weak. And every time you try to suck in that milkshake, the straw collapses and nothing or very little shake gets in. During sleep, the muscles of the upper airway that help to keep the airway open tend to relax. For most people, this isn't a problem. The airway stays open and they still breathe fine. But for others, the upper airway becomes more like the weak straw we talked about. But instead of not getting any milkshake, you're not getting enough or any air. Looking here, if the airway only partially collapses, this is what leads to snoring. There's just enough room in your airway for some air to pass, but it causes a vibration of the tissues, and thus the sound of snoring. So, in this diagram, if a partially collapsed airway can cause snoring, this next diagram drives home what happens with obstructive sleep apnea. The airway collapses or closes enough that essentially no air gets through. You try to breathe, but you just can't. No air is passing through, and that's a problem. You're essentially suffocating, and you don't even know it. As a result, your oxygen levels plummet, your heart rate spikes, and your blood pressure goes up. Eventually, a signal is sent to your brain to contract certain muscles, which opens the airway. Sometimes this is accompanied by what's called an arousal, but it's important to understand that during an apneic event, you don't necessarily wake up. Instead, as you recover, you go from a deeper sleep to a lighter sleep. You essentially catch your breath until the next time this happens. And in sleep apnea, this can happen with relative frequency throughout the night. Now, sleep apnea is much more complicated than what I've shown you in this video. There are other factors related to apnea that can cause your airway to collapse. For example, some people naturally have small airways, and for others, sleep apnea occurs because of a lack or a miscommunication between your brain and, let's call it, your breathing system. The point is that this is a process that happens repeatedly throughout the night, again and again, and this is taxing on your body, including your heart. Having apnea is not something to scoff off. In fact, obstructive sleep apnea affects you on two fronts, your quality of life and your health. And in upcoming videos, we'll tackle both of those issues. Until then, I appreciate you checking out this video. Please hit the like button and definitely subscribe for more videos just like this one. If you'd like more information about Carolina Sleep Solutions and what we do, please check out our website. Finally, if you suspect you or a loved one has sleep apnea or a problem with snoring, please share this video with them. Until next time, remember, at Carolina Sleep Solutions, we want you to breathe well so that you can sleep well and be well. Thanks for watching. See you next time.